Hello, I'm Shaun, Occupational Therapist, and I work for Theraposture. I want to talk about falls prevention and the role of assistive equipment. Now, fractured neck of femur is very common as a result of having sustained a fall. And as OTs, we strive to implement safe practices in and around the home environment to minimise the fall risk. This is often by education with alternative methods of completing tasks, or with the prescription of assistive equipment, which can ultimately reduce falls risk for our clients. Now, falls can have a huge impact on wider implications, such as a hospital admission, surgery, a prolonged hospital stay if surgery has been carried out, an increased risk of hospital-acquired infections, a low mood, reduced confidence, anxiety, rehabilitation may take place in hospital and at home, reduction in independence, and increased family member support for shopping and cleaning activities around the home, maybe discharged with some domiciliary care, and also some assistive equipment prescription. Now, falls can often occur with chair transfers, toilet transfers, mobility, and bed transfers. Now, with chair transfers, you can look at something that will assist to sit up, to help you stand. And obviously the introduction of something with motors is always a fine balance to it, whether it's going to reduce any muscle function. So always be carefully considered. Raising a chair, just so it's at a safer height of transfers, is a good option as well to start with, just to make that transfer safer. And toilet transfers, they can be the provision of a frame around the seat, a raised seat, also wall-mounted grab rails, and all these to obviously reduce the risk around toileting as well. Now, mobility. Now, an environmental survey around the home, eyes everywhere, will identify any potential trip hazards, such as rugs, thresholds, internal steps, all of which can be minimised with positioning of grab rails and the removal of a lot of trip hazards as well around the home, because if they're not there, an edge of a carpet, you can't trip over it. A suitable walking aid in some instances as well, just to maintain that balance when mobilising. With bed transfers, after a night's sleep, or if a client is getting up to use the toilet at night, it's often one of the most common high-risk areas for a fall to occur, because you're asking our legs to fully weight bear. Now, if you have a bed with a variable height, you can do the transfer gradually, because rather than as you stand up asking your legs to fully weight bear, if you've got something with variable height, you can do this gradually. Lift the bed up, move forward onto the mattress. Lift the bed up, move forward onto the mattress. And then the muscles are anticipating that there's something that's going to happen, and they need to kick into action, basically to support the body weight. This is a much more controlled transfer, and it gives them a more stable base of support, muscles, lower limbs, in anticipation of standing. So it can be a very good reduction in the way to minimise falls. The falls are very quick, very frequent, and the impact should never be underestimated, as the psychological events can have a very long-term effect on health and well-being. It can severely reduce a client's confidence around an associated event that actually led to trigger that fall. So it can really increase anxiety, and this can result in a client being far less likely to want to participate in a particular activity when they had a fall. And I think I've always been a believer in the phrase "use it or lose it," and I think that's so true with mobility and muscle function, because the older we get, in some cases it can be a more sedentary lifestyle, and this has a detrimental effect on muscle function. Seated exercise is something that should be carried out for someone that's more sedentary on a very regular basis, just to make sure that we're maintaining the strength and the mobility within the lower limbs. Because it's, as I've said, with chair transfers, when you introduce something with electric motors, it's always a really fine balance as to whether you want to increase the muscle function. That's the thing that's making it harder to stand up, and an increased risk of falls, because if you've got the reduce muscle function, that increases the safe falls risk. But it's just a balance with motors within something that I think going to often assist with that transfer. We get that balance right, and it can work really well for clients and make them more independent and significantly reduce that falls risk. Now, assistive equipment provision, for many clients, is a vital intervention which can significantly reduce their falls around the home, and furthermore avoid an unwelcome hospital admission. So, it needs to be considered very carefully what you're going to implement for that client. But ultimately, you want to reduce that falls risk around the home and make that client safer.